Saving lives starts with a single drop. Good day everyone, we are Group 1B of Buizon 3D and I, Arabela Banay, along with my group members Sophia Barbasa, Vince Borja, Khami Butanas, and Clyde Buizon will be presenting our study entitled Knowledge, Attitude, and Practices of Nursing Students Towards Blood Donation. Our study focuses on blood donation, a vital voluntary act for medical use. Although nursing students are expected to be health advocates, strong knowledge and positive attitudes do not always lead to blood donation. This gap drives our study to assess participants' knowledge, attitudes, and practices to correct misconceptions and promote voluntary blood donation.
Objectives of the study. This study aimed to determine the level of knowledge, attitudes, and practices of nursing students towards blood donation. Specifically, what is the demographic profile in terms of age, sex, year level, religion, and blood donation history? What is the level of knowledge towards blood donation when taken as a whole and one group according to demographic profile? What is the attitude towards blood donation when taken as a whole and one group according to demographic profile? What are the practices towards blood donation when taken as a whole and one group according to demographic profile? Is there a significant relationship between the level of knowledge towards blood donation and demographic profile? Is there a significant relationship between attitude towards blood donation and demographic profile? Is there a significant relationship between practices towards blood donation and demographic profile? And lastly, is there a significant relationship between knowledge, attitude, and practices towards blood donation among the participants?
For the significance of the study, our study benefits key stakeholders by improving the nursing curriculum and supporting donation campaigns. It also helps public health workers and blood banks develop targeted strategies, while encouraging students to donate and serving as a basis for future research.
We base our theoretical and conceptual framework on Pender's health promotion model and Adjun's theory of planned behavior, which explain how students' demographics and social factors influence their knowledge, attitudes, and donation practices.
Our study is guided by four null hypotheses, stating that there is no significant relationship between participants' demographic profile and their knowledge, attitudes, and practices on blood donation, and no significant relationship among knowledge, attitudes, and practice themselves.
For the methodology for the research design and method, our study uses a quantitative descriptive correlational design to assess nursing students' knowledge, attitudes, and practices on blood donation and determine the relationship with demographics using a standardized survey. For the participants, our study includes levels 1 to 4 nursing students, selecting 335 from 1,020 using Cochrane's formula with 20% attrition, and applying certified random and systematic sampling for fair representation. For the data gathering procedure, we followed a 5-step process involving ethics approval and clearance, coordination for face-to-face surveys, securing informed consent, and verifying and encoding the collected data for processing.
Data were analyzed using SPSS with percentages and frequencies for demographics, mean, and standard deviation for knowledge, attitudes, and practices, chi-square and Kramer's V for relationships, and Spearman's correlation for ordinal data. Our study used a standardized 4-part questionnaire validated as very good with a score of 3.84. Included demographics with 7 items, knowledge with 20 items, with a reliability score of 0.710, attitudes with 10 items, with a reliability above 0.70, and practices with 6 items, with a reliability of 0.895. For our ethical considerations, we secured approval from the College of Nursing, obtained informed consent, maintained strict confidentiality, and stored data securely on an encrypted platform for 2 years in compliance with the Data Privacy Act of 2012.
In SOP 1 for age, most participants were 20 to 21 years old at 40.4%, followed by 19 years and below at 40.3%. Those aged 20 to 23 made up 16.7%, while only a few were 24 and above. Overall, respondents were mostly young adults within the typical undergraduate nursing age range. For sex, most participants were female at 70.4%, while males comprised 29.6%. This reflects the continued female dominance in the nursing profession influenced by traditional gender roles and societal expectations. In SOP 1, in terms of year level, Level 1 students comprised the largest group at 31.6%, followed by Level 2 at 27.2%, Level 3 at 23.6%, and Level 4 at 17.6%. The decreasing trend in higher levels may be due to increasing academic and clinical demands. For donation history, most participants were non-blood donors at 94%, while only 6% have previously donated blood. This shows that despite their medical background, most nursing students had no prior experience with blood donation and remained uninitiated in actual donation practice. For religion, most participants were Catholic at 77.6%, while 22.4% were non-Catholic. This reflects the predominantly Catholic population. For SOP2, the study found that nursing students had high knowledge of blood donation with a mean score of 11.99. Higher knowledge was seen among older students, higher year levels, females, and those with prior donation experience, while males had lower scores. This is supported by Althewasi et al., who noted that knowledge improves with academic exposure. Based on Pender's model, knowledge reduces fear and supports readiness, but gap still needs to be addressed.
For SOP number 3, the level of attitude towards blood donation when grouped as a whole is categorized as favorable, with a mean score of 44.31. A favorable attitude was also observed across all demographic groups. This is consistent with the studies showing that nursing students hold positive attitude towards blood donation and view it as an altruistic responsibility, as reported by Azaldan et al. And Afshan et al. Based on Pender's health promotion model, this favorable attitude may be influenced by perceived benefits of blood donation and exposure to health education and clinical experiences. For SOP number 4, the level of practice among nursing students towards blood donation was relatively low, with an overall mean score of 24.30. Only students aged 22 to 23 years old, level 4 students, and those with previous donation history showed proactive practice. This is supported by Rosazeta et al. And Kadlikar et al., who both reported low donation practices. This can be explained with the health promotion model and theory of planned behavior, which state that perceived barriers, self-efficacy, subjective norms, and perceived control affect whether intention leads to actual practice.
For SOP number 5 regarding knowledge and demographic profile, there were significant relationships between age, sex, and academic level. Higher knowledge were seen among older students aged 24 years old and above, females, and level 4 students, while lower scores were found among younger, lower years, and male students. This is supported by Yehe et al., who reported that knowledge increases with age and academic level. In line with Pender's promotion model, personal factors such as age, sex, and academic level influence exposure to information and knowledge development. And for SOP number 6, the results showed no significant relationship between attitudes towards blood donation and all demographic variables. This means respondents generally had similar attitudes regardless of age, sex, academic level, religion, or donation history. This is supported by Bijoy et al., who also found no significant relationship between demographics and attitude. In line with Pender's health promotion model and Adjun's theory of blood behavior, attitudes are shaped more by shared experiences and social influences rather than demographic factors.
For SOP7 regarding practices and demographic profile, only academic level was significantly associated with blood donation practice, with higher participation seen among level 4 students. Age, sex, religion, and donation history showed no significant relationship, indicating similar levels of practice across groups. This is supported by Tally et al. 2020, who found higher academic levels are linked to greater donation practice. This can be explained by the theory of planned behavior, where increased experience improves perceived behavioral control and strengthens intention to donate.
For our SOP 8, the results showed significant positive relationships among knowledge, attitude, and practices, with the strongest link between attitude and practice, meaning attitude most strongly drives blood donation behavior. This is explained by the health belief model, which states that behavior is influenced not only by knowledge, but also by perceived benefits, barriers, and self-efficacy, highlighting the need to reduce barriers and strengthen confidence to improved actual donation.
In summary, nursing students show high knowledge and positive attitude towards blood donation, but their practice is low, with academic level influencing awareness and readiness, highlighting the need to address barriers that prevent translating intent into action.
And to conclude, we recommend that administrators strengthen the integration of blood donation education in the curriculum and support campus-wide donation campaigns. Public health workers and local blood banks develop targeted student-friendly recruitment strategies. Nursing students actively participate in blood donation and serve as peer advocates, and future researchers further explore barriers, motivations, and effective interventions to improve donation practices.
For the utilization, the study results will inform the institution, faculty, and students about nursing students' knowledge, attitudes, and practices on blood donation, and support the College of Nursing in improving education and promoting voluntary donation.
You may access our references by scanning the QR code in the top right corner of the screen. And for the acknowledgement, we, the researchers from the BSN 3D Group 1B, sincerely thank Almighty God, the College of Nursing of the University of St. Lasal, Bacolod, our study participants, our research facilitators, Dr. Sheilla and Trajera and Dr. Rica Flores, and our families for their guidance, support, and encouragement. That is the end of our presentation. Thank you for listening.